Right, joining me to discuss this is an expert in this field. It is Dr. Gaurav Mateesh. He is a consultant in gastroenterology at Zahra Hospital in Dubai. Hello, Dr. Mateesh. Zahra Hospital in Dubai, sorry. Hello, Dr. Mateesh. Thank you so much for joining us on the show today.
Morning, Katie. Pleasure touching base with you.
So I want to know, the appendix, why has it been considered so expendable for so long?
Well, for a long time, we thought this is something that's not very relevant, not very important. There was data that, we saw complications arising out of appendix inflammation called appendicitis. And that's why removal of appendix was considered to be the standard of care for a condition called appendicitis for a long time, because we thought that it doesn't really serve as well a purpose as we currently know that probably it does.
And now, though, we've had new research out suggesting that the appendix role in the body could be actually more useful than we first anticipated. What can you tell us about that?
Well, absolutely. See, our body has a tendency to get rid of the organs over evolution, the ones that we do not really need. And that's what has happened with a lot of evolution as we have grown from being apes to what we are like Homo sapiens, the human beings today. But surprisingly, appendix, although being labeled as a vestigial organ, has stood the test of time. It has stood for more than 80 million years, and it still persists in 30 mammalian species, thereby suggesting that probably it has more role than just be labeled as a vestigial organ today. So I believe it does have some role to play. Yes, it's not essential like your heart, your brain, your lungs, etc., but it has a supportive role nevertheless.
What about this research in terms of it helping in gut bacteria and immune function? What would be your professional opinion on that?
Absolutely. So it is a safe house. It is a storehouse for our immunity in the gut. So when you get these infections, the colonic infection that you get, the normal gastroenteritis that you get, it helps reseed the colon after that infection. It gets the good bacteria in place. There is also research that suggests that possibly after you've taken a heavy course of antibiotics, when your gut is cleansed from those good bacteria, this helps reseed the entire gut with those healthy bacteria back again. So it is for immunity, you can say that. Secondly, it has a very important immune function. It helps screen infections when you're growing up. So just like your spleen, which is a lymphoid organ in the body, it screens what is your own and what is foreign. It does secrete certain antibodies that helps fight infections. It does help secrete white blood cells which help fight infections. So it's not really vestigial in true sense. The more we learn about it, the more intrigued we are.
Exactly. Richard Dean on the Business Breakfast was asking about the gallbladder. He's had his removed. I don't know if you can add any insight into that, Doctor. Do we need a gallbladder, or is that not your field?
No, absolutely. See, we do see a lot of gallbladder patients. That's absolutely something that's very, very relevant in today's world as well. But again, you remove certain organ only if it's giving you a problem. If your gallbladder is inflamed, if it has stones which is causing pain, if you have any infection of the gallbladder wall, which we call as cholecystitis in medical terminology, if you have a stone from the gallbladder that has fallen into your bile duct and obstructing the flow of bile into your intestines, these are certain very well-established indications for removal of gallbladder. But anybody who has, random sitting stones in gallbladder, or anybody who has appendix for that matter, doesn't warrant its removal.
So I was going to say, have perceptions clinical practice when it comes to removal? Is it the default to remove an appendix or even a gallbladder now if there's an issue with it? Or do you see there's enough benefit to keep it in the body and try and mend it per se?
Absolutely. That's an excellent question. We don't remove any organ until and unless it is problematic. Yes, there are conditions like appendicitis. That appendicitis means that there's inflammation of this small 5 to 10 centimeter long tubular organ, which causes a cascade of inflammation, which can often result in any abscess formation. It can result in severe infection of abdomen, which we call as peritonitis. Sometimes it may rupture. These are the conditions when it becomes a medical emergency and you might need to remove it. But that doesn't mean that anybody or everybody who has an appendix warrants an appendix removal.
Should anyone that's already had their appendix removed be worried now that they're missing out on some amazing gut bacteria, or perhaps their immune response isn't as good as it should be?
Well, possibly. I don't think the concern would be a right issue. I do believe that the reason why the appendix was removed in the first place was because it was inflamed or infected for that matter. And that is exactly the indication for which it is always. But yes, going forward, anybody should not get an appendectomy or removal of appendix just because they have one. And that is something that we strongly advise against. And that's been the standard of care for many, many years.
Dr. Mateesh, before you go, one last question. Was the appendix there to help us digest grass, or was I just told a fiddle at school?
Absolutely. See, as we evolved from, primate humans to what we are today, we used to be grass eating, bark eating, very high fiber eating, species. And that's the reason it had very huge role in storing those kind of bacteria which digested the cellulose, which is a very difficult fiber to digest otherwise. As we moved towards being omnivores and we were eating more meat, the organ shrunk in size. It became very, very limited, but still existed. Still it hasn't vanished. So yes, it did have a role to play. I do believe it has a role to play today as well. So if you have a healthy appendix, do not think of removing it.
Great. Thank you so much for that conversation. That was the voice of Dr. Gaurav Mateesh. He's a consultant in gastroenterology at Zahra Hospital in Dubai.